Good afternoon, everybody. Thanks for joining again after the coffee break, and we truly apologize for the schedule being slightly delayed, but we're trying to keep it short and to the point. Are you all set? Perfect. So I would like to very formally thank you, officially, all four of you for joining us today in Athens. It's a true honor to have such distinguished academics and experts joining this conversation on the National Action Plan for Childhood Obesity in Greece and to provide your insights and your views. I also like to personally thank you because you invested weeks or even months in some occasions on shaping today's agenda. And it's a true honor for UNICEF, the Ministry of Health, and Greece in general. So welcome. And I'd like to kickstart the conversation with a very, let's say, brief approach on understanding a little bit more on your expertise, because for some of us who don't really understand public health, your field might seem very similar, but each of you focuses on a very different and specific component. So we'll go around the floor and understand a little bit more what is your specialty and what you're focusing on. So I'll kickstart it on what is the core challenge. I'll start with you, Lee, that your expertise and your research focuses on when addressing childhood health.
So thank you. First of all, ευχαριστώ πολύ and kalispera. I am a pediatrician and a public health researcher and the spouse of a Greek American, so I have family here in Crete that we're going to be visiting. The challenge that I most see are health inequities. Dr. Galil spoke about this earlier. The moral determinants of health is what I look at. Preventable disparities in outcomes for children that affect their entire lifespan. And so that's what I address in my clinical research and systems level research. Thank you.
Thank you, Lee. Niyati.
Thank you. I'm Niyati Parekh. I'm a professor of public health nutrition at New York University. I'm an epidemiologist by training, but in my previous life, I was a registered dietitian, so I really approached this from the food and nutrition perspective. I also want to say that for me, as a nutrition person, Greece and Crete was the birthplace of the Mediterranean diet. And to now see such a transition and so many chronic diseases is why I'm so interested in doing this here in Greece. So the main challenge really is that there's been a growing mismatch between modern environments and healthy child development. And as it was correctly framed in the morning, it's a multifactorial issue. And it's much easier and cheaper and more convenient to remain obese than it is to remain healthy. So that is my big challenge.
Over to Jill. Thank you.
Yes, hi, Jill from the University of Colorado. I feel the challenge is changing families and the culture and the community, and a lot of times I feel that obesity in children is really a community, can happen in a more likely to be prevented if we can approach it at a community level and really the whole child that sleeps and eats and does homework in social media. There are so many factors, and my approach or my challenge to everyone is really to focus on the family unit and then the community unit and improve communities. Thank you.
Thank you.
So, good afternoon, everyone. I'm so honored and inspired to be here. I think we maybe not feel it today, but I think it is a historic moment. We will look back at this moment, we were in that room when it happened. And my background is I'm a professor of food studies, nutrition, dietetics. I'm also associate professor of pediatric science. I'm the chair of the EASO, European Association for the Study of Obesity, working group on childhood obesity. And I have many hats, but the hat I'm most proud of is that I'm a family therapist. So I try to understand in my research how we can involve children and families in treatment and to start the conversation and keep the conversation ongoing. And I've heard a magic number of 75%, that 75% of parents were involved in the intervention, one of the interventions that was mentioned, and it's mind-blowing, if I can say. But the question is, what about the 25% of parents? And also, how can we keep the 75% parents engaged in a sustainable way? So the implementation.
Perfect. Thank you so much. We all understand that there are so many elements when designing a national program, prevention programs, especially focusing on childhood, addressing childhood health in general. So even though we're going to hear in detail and we're going to deep dive during your keynote speeches, I'd like to, for the audience and for those of us who are joining online, to understand a little bit more on the very specific elements that you each represent. So Jill, I'm going to mix it up a little bit. Jill, on your perspective and through your research, when designing these national programs and prevention strategies, are there still elements that are missing from our designs? Are there still elements that we are not really taking into consideration that we should?
Yes, thank you. So my passion is, again, the family unit and community. And what I find is sleep is a huge problem within families. If it's access to their own bed, youth, or are they sleeping, in a smaller dwelling and more families are in one unit, and sleep is not something that is made a priority. And I feel that sleep needs to be at the forefront of obesity prevention, and as well as mental health. And I'll talk about in my keynote later about this approach that I like to refer to as a whole health for every youth. And so diet, physical activity, screens, those are all very important. But you also have to add to the equation sleep and mental health. And those things don't occur in isolation, yet our prevention programs, I feel, are siloed in those elements. And I would like to see more of a whole health approach. So I'm a behavioral epidemiologist, as you can see on these slides, and I really focus on reducing health disparities, improving health outcomes of all youth by developing evidence-based interventions that can be scalable. And when I implement these and I create systems, I do it at a community level, not necessarily at the individual level. And I think that interventions that are going to be sustainable in the future and have the biggest impact are the ones that are designed by the communities for the communities they are in.
Thank you so much. Such an important point. And just a quick reference for, I'm sure most of you are familiar that apart from the National Action on Childhood Obesity, we have the privilege with the Ministry of Health to also run a second program on child and family health, which is addressing specifically the components of screen time, community engagement, mental health. So as you said, everything comes together. It's not one size fits all, and all elements on a childhood matter. Yes. Thank you so much. I'll pass it over to Lee, and I'll focus a little bit more on sustainability and long-term impact. So when we truly want to make a difference, what are those ingredients that we should be making sure that exist in our interventions with community?
Yeah, well, I talk about 4 ingredients here for the science for every child to live the longest life, and those ingredients are trust, community, love, and magic. I tried to learn the Greek words for that this week. So when we talk about trust, it's about setting individual goals to promote family-centered health behavior change. It's somewhat Jill was talking about, but we do this on the basis of research, evidence-based research, and social cognitive theory. So for that, I think about the parents having self-efficacy, but also outcome expectancy, that this is important to them. But also for the yayas and the papus, it needs to be important to them to do that for their family. At the community level, we need to involve lots of people that were talked about, we spoke about and heard about earlier, not just in the homes and the schools, but also in the sporting fields, the papas in the churches, the small business owners. And then love is very important. I speak about love and magic now in my research. Love is about strengthening safe, healthy relationships between nurturing adults and growing children. That's where the mental health that Jill talked about comes in. And magic, Maya, is to me the most important ingredient. This is the hope that the health minister brought here this morning. The hope that we can work across ministries of health, food, culture, and education with a child mind, with creativity, with joy, with hope. These are the principles that seem to be working in the research that we all do, and we try to infuse our new platforms with this. I want to end with something, though, which is humility. I'm trying to practice humility here. I'm from the United States. I'm learning from many of you in the Mediterranean countries here. And we practice a lot of humility when we do this work, listening to local communities. What works in Rethinking might not work in Athens. What works in Mytilene might not work in parts of Thessaloniki. So I think we really need to listen to local communities as we do that. Yeah.
I will hold on to that point. I'll ask you a very quick follow-up question before I pass it over to Niyati. You mentioned behavioral change, and you mentioned listening to communities. Why is this so important when when designing national actions? Because you said Mytilene, Thessaloniki, there are also differences in these.
There are differences. There are cultural differences. Food, the health minister said before that food is medicine. Food is also love. It's the way we express love. And so we did this. I'm going to be talking later about a primary care and pediatrician program that we did systematically to improve obesity prevention. We needed to listen to families in 6 different areas of the United States, immigrant families, about how they were feeding their children. It wasn't how we thought they should be fed. It was understanding different feeding practices, starting in infancy, and different practices of spending time with one another, so that we're not preaching. We're joining hands, we're co-designing, we're co-producing solutions. I think that's why our program was one of the only that's actually been shown to be effective, is because we work with communities. Otherwise, you might lose the effect. I want to hear from my colleagues here, because they do this work as well, but thanks for the question. Yeah.
Thank you, Lee. And just a quick note that we have been attempting, hopefully successfully, to integrate voices of communities, children and youth. And later in the day, we already have our Child and Youth Advisory Board representatives with us throughout the day. They will also share their own perspective, because as you said, you cannot really preach unless you understand what are the needs and what people are willing to adapt to. Thank you so much. But apart from these sort of targeted and behavioral interventions, we should acknowledge that children nowadays grow up into these global environments that are not necessarily promoting healthy patterns and healthy, what is the word? The healthy environments and healthy habits. Thank you, I'm sorry. And healthy habits. So I'll pass it over to Niyati, and I'd like you to sort of share with us these major realities of what healthy environments or not so healthy environments means for children.
Thank you so much, Olga. So, like I said, this is multifactorial, but maybe I'm just going to stick to my expertise, which is the modern food system. We have really seen huge shifts from traditional food systems to modern food systems, and I have a lot to say about youth practices, and I want to say the youth, so let's say those who may be teenagers or in their second or just finishing their second decade, okay? They have grown up, if you look left, right, like they've grown up with the industrial food system. Some of us who are a few decades older at least have had a sense of what it means to sit on a family table. There are extremes, of course, everything in between. Know what it means to cook traditionally, to share those recipes with your family. But being in New York City, I'm seeing just the opposite. Very often, the kitchens are really tiny, and some don't even have kitchen access at all, right? So all this to say that there's been a huge shift in the eating and patterns and food systems. I think the main issues are the widespread availability of ultra-processed foods. It's just omnipresent, and it's the most convenient thing to be there. So whether you're in a school setting or a college, it's so easy to have the dried, quick snacks. And snacking wasn't even really a practice globally in many countries, but since the emergence of these foods, it's become a thing now. People actually snack. The other thing is the digital and the targeted food marketing. Everyone is on their devices. Machine learning has been very smart, and that's the other issue that makes it more tempting, I think, to buy into this new food system. The economic pressures and food affordability is a real thing. It's cheaper and more convenient to be obese and develop excess obesity, adiposity, I mean, and not always having access to even footpaths. I'm thinking about India. I just got here from India. It's not a walkable place at all, and you need to actually pay for gym membership, and there aren't as many open spaces. So I think just the affordability of healthy lifestyles is a big question. And I want to say urbanization. There's so much development that cities are sometimes coming close with just urbanization, getting rid of farms, getting rid of local, even small plots of production. I want to also use a word you may not have heard before, supermarketization. So it's taking away some of the wet markets and the small markets that are set up by farmers, and huge corporations are setting up and making sure that there are good, robust delivery systems for their products. So supermarketization and urbanization is a big problem. And the last thing I want to say is goes more to sustainability. We don't really think about food systems necessarily in terms of climate change, food waste, the packaging, the plastics, the production costs to the environment, the usage of water. All of this is really problematic, which eventually will have a long-term impact on children's health. So in a nutshell, for me, it's really the changing environment. And I'll end by saying that I'm trying to take away the onus from the child or the family and personal responsibility to the environment, which is really where ministries can play a very, very big role. Thank you.
Thank you so much. And listening to you, even though your perspective comes from different countries across the Atlantic, we're not that different after all. I think that we're all facing the same challenges, especially when it comes to addressing these global food systems. So I feel that it's a very key component in our discussion. Going all the way down to Paulina. Paulina, you've worked with communities and families and children specifically a lot on your research and your academic career. What have they taught us? What have children and families taught us thus far on the design component, and what can we still learn from them moving forward? Thank you.
So one of the strongest lessons from research and clinical practice is that successful interventions cannot rely on blame and shame. Families engage when they feel understood, respected, and supported. Unfortunately, many of families' parents enter healthcare system already being stigmatized, already fearing that they're maybe not breastfeeding enough or maybe not attentive enough. So they have enormous, they feel self-doubt, they feel not empowered enough. And it's not only a ethical matter, it's a practical matter, because in order for intervention to be sustainable, we need that families feel that it's not a focus only on physical well-being, but also sustainable interventions support children's dignity and well-being. And I really like what João Breda said about mental health. How can we help? It's not about reducing prevalence of childhood obesity. It's about seeing our children that they matter at every side, that they are not singled out, and that they can thrive. So that's what I'm going to talk more in my keynote.
Thank you so much. Again, such an important ingredient of shaping these strategies. I will like to, we have here with us today policymakers, we have academics, we have decision makers as well in governments and international organizations. If you had to leave us with one main takeaway point, one piece of the puzzle that we should definitely not leave out when designing these strategies, we are reaching the end of this National Action Plan, but this does not mean that this is the end of our interventions in Greece, in Albania, in Brazil. We have representatives of all these countries here, and all the other countries that are going to be listening to this discussion. What is this main puzzle piece that all of us, all the decision makers, should not leave out of the planning and intervention process?
Can I start?
Sorry, you're right. I will start with Paulina and I will take it.
So we usually say in other contexts that we need political power and courage, and you have it. And this is very unusual. And again, I'm inspired and admire. But now you also need long-term investment and political will, and also to think about, because now we are entering in a new phase of the strategy, the implementation. And implementation, like weight maintenance, is the most tricky one. So my message is to work with implementation experts to help you how to make it not only innovation, but a culture change, because this is what it should be.
Thank you.
Just to kind of take what you said and move it forward, the impact of the family unit, but then the impact of the community. And I think for me, it would be making sure that all of those individuals are on the same level of basic information of why health matters, how to be healthy, good quality of life, and really bringing the community together and giving them the autonomy to know which parts they would like to work on, what type of intervention can they do sustainably in that community, and what does that look like. And I'll talk about it later today, but after years and years of trying different solutions, it's really that community building that is key, and then leaving behind a intervention that meets the needs of that community, but then that they are empowered to continue delivering it even after we are gone as the research team or the intervention is in place. And I think the other thing is really making sure we have not only the voice of other adults and school teachers and providers, educators, but also have the youth voice in there. And if you're going into, an elementary school where you have the tiniest kids, keeping them at the table, your middle schoolers, keeping them at the table, and the high schoolers, and really having all of those key members at the table when you are implementing any new strategy for the future.
Perfect. I believe there is, should we continue? And okay, we will continue. And there's an intervention from the floor. I guess we inspired some colleagues to jump in. Niyati, over to you. Thank you.
Thank you. I think my central message to policymakers is, again, what I said. It's children's health is increasingly being shaped not only by individual choices, but by the commercial environments surrounding them. So I feel policies should really go beyond education alone and personal behavioral change and attack the structural drivers of unhealthy diets, unhealthy lifestyles, including food marketing, pricing, accessibility, corporate influence, to just create healthier systems that protect children and their long-term being. I just want to say one thing that we've tried very hard for years is that multiple stakeholders need to be included in this conversation. It could be urban planners, it could be economists, it could be, I think I'm stating the obvious. And that's what public health is, to actually try and bring in all the various non-traditional stakeholders. So even if I'm a nutrition person, I think it's important to work with all of this. And somehow the conversation sort of starts and stalls. It's not been that easy to fly with a multidisciplinary team, which we cannot solve this problem without that. That's really where the ministries come big time into play. So,
very important. Not just whole of society, whole of everyone being part. Lee.
Well, obviously, these brilliant women stole my thunder. I agree with everything they just said. It's phenomenal. In addition to lifting up the voices of everybody, including the youth, and the interdisciplinary collaboration, which I think is very important. This cannot be just an issue for the Ministry of Health. It needs to include education, finance, labor, culture. And I am inspired by what's going on here in Greece. I think my main message is keep up this amazing work and own the tradition of Greece. So not only is this the home of Hippocrates, they took the Hippocratic Oath, which is medicine, but Hippocrates also invented public health and hygiene. It's the home of Plato, who is not only a philosopher in the cave, Plato's allegory of the cave, but also ensured that in Athens was the first place to introduce civic health officers. So it goes from Hippocrates and Plato to Venizelos. So more than 100 years ago, a lot of the modern universal healthcare systems were started here. And Akabadaki and the health ministers can continue that tradition. It is phenomenal. It's what was said by the minister from Cyprus before. Go back to the future. This is the place of the Mediterranean diet. I was in the National Garden yesterday for the wellness initiative. I guess there's a wellness day there. And this is what I saw. This is the intervention. Little bottles of water being given to the children. If we go back to the future, it's about drinking water and breaking bread around a Mediterranean meal in the center of town with the kafaneos and the tavernas and the dancing that is physical activity. That's what I hope. Go back to the core and keep up the great work.
Truly humbled for your comments on the national action, and thank you so much for commenting on it. We have so much to look forward during your keynote speeches. Thank you so much for giving us a very short preview. For those of us who are not familiar with public health, I'm sure that by now we understand the complexities of addressing such issues, especially addressing all the special needs of each child and family, not just in one country, but globally. Thank you for your time. Thank you again for being here, and we very much look forward to listening to your interventions. Thank you. Before we close, I'm sorry, there is an intervention from the floor. It's our UNICEF representative in Greece, Ghassan Khalil. The floor is yours. I'm sorry.
Thank you. Very quickly, but another wonderful, inspiring panel. This was really great. And I would like also to complete that academia was born in Greece. So having people like yourselves, I mean, is also, you very much fit into the context being our distinguished guest. But what I want to say that the complexity that my colleague Olga has mentioned, the complexity in bringing about a transformative public health policies, I mean, this complexity can be smoothened by one thing that I got from the four of you, which is bringing understanding and love. this is what was common. And these two values, understanding and love, are both mentioned in the preamble of the Convention on the Rights of the Child. And moreover, love is mentioned only in the Convention on the Rights of the Child among all other human rights treaties. So to bring the change we'd like to bring for healthier children, healthier generations, healthier society in general, I would rely, since Professor, also you mentioned the Greek, very powerful terminology, I would like to rely on a term that I learned from Olga 3 years ago when I first joined Greece, which is doing things with meraki. So doing things with passion, love, compassion, and understanding. Thank you.
Thank you so much. Thank you. You all bring a lot of meraki here today, and we thank you so much for it. And see you in a few minutes. Thank you, everyone.